Remember hearing about how a certain amount of accidents have to occur before a stop sign will go up. Well, this reminds me of drugs. Like a certain amount of adverse effects, sometimes really serious or even deaths, have to occur before they'll take a drug off of the market. And then sometimes they still don't take it off the market. They just make a black box warning. Well, this is what's occurring with the glitazones, some of the diabetic drugs like Actos and Avandia. In fact, in France and Germany, they have even taken them off the market. So let's talk about why they took them off the market and why we're not taking them off the market.
Well, these drugs are really not safe drugs. In fact, there were 3 drugs in this family originally. There was one called Resula that was taken off about 15 years ago.
Didn't that cause liver failure?
It caused liver failure and was causing liver transplants and lots of problems. Then Avandia came into the news because it's something that caused heart attacks and strokes. And it wasn't just a little bit, it was like 50 or 60% higher. And of those people that got them, about 50% more deaths occurred. It's still on the market in this country. Then we get to Actos, and the big thing with Actos was that it caused congestive heart failure, but that it also caused these problems with people having bladder cancer.
Significant amounts of people with getting bladder cancer, and now they've added Avandia to the mix.
Well, Avandia causes it as well. So we got a whole class of drugs here that's a loser, as far as I can see, and the black box warnings don't make them any safer. There was a study that was done based on the fact that people who have diabetes have an elevated incidence of bladder cancer to start with. It's slightly more than normal, maybe about 30% more than what you'd expect in the general population.
So then you give them diabetic drugs, and then it increases their risk, what, 4 times?
Well, yes, at least 4 times. When you're looking at the sulfonylurea drugs, those are drugs that are used to lower blood sugar levels.
Like glucotrol?
Like glucotrol. You have an increase over the normal amount that diabetics have of another about 30%. And then when you add the glitazones to it, it's another 2 or 3 times more than what you see with a sulfonylurea drug. So if you look at just a normal person's risk for bladder cancer and then look at the risk that they have when they're taking the glitazone drugs, it's up 4 or 5 times. So this gets to be a big number. And the thing that really irks me is now we're seeing the FDA approve Actos to be an over-the-counter drug, which means you'll be able to buy it. Yeah, there'll be these little warnings about it, but you know how advertising goes? They're going to highlight the good things. They're going to minimize the bad things. People are going to be able to get these drugs and use them without any medical background.
So what do you say to people that say, so what do? I have diabetes. What should I do?
Yeah, they should do something about getting rid of their diabetes through lifestyle. There's no medicine on the planet that has the power of lifestyle. It is extremely effective at getting rid of almost in 100% of people who have type 2 diabetes.
With diet, exercise, stress reduction, getting enough sleep, having a meaningful purpose in life, and how about meditating?
Sure, and even weighing what you should. You do all those things, the diabetes nearly always goes away. I've got dozens and dozens of patients who have followed this advice. Their diabetes is gone, and they're not taking any medications at all.
And what they're recommending now, that they're saying that this is good information for doctors so that the doctors can check their patients for blood in their urine and symptoms of bladder cancer. Well, that's after the cat's out of the bag.
Exactly.
We don't want that to happen. It's like, oh, okay, it's all right. We'll just catch it early.
We've become a drug culture that depends on pharmaceutical drugs to bail us out of what we won't do ourselves to keep us healthy. You can't forget that there's nothing more powerful than lifestyle to manage every illness that there is, and it prevents most of them too. With the combination of the things Vicki just mentioned and the toxic exposures that we've put into the environment of more than 100,000 new drugs that weren't here 100 years ago, it's pretty intimidating for our poor little genes and our little DNA molecules to try and function normally because of the epigenetic effect it has on them. And what I mean by that is it tends to cause changes in DNA, changes in our genes that put us at higher risk for developing all kinds of diseases, not just diabetes.
Okay, so what about the drug metformin? We haven't mentioned that one, and a lot of people are on that, and they might be wondering.
Of the drugs that are out there, this is one of the oldest that's been out there. It actually lowers the risk of cancer in a lot of people, and it's a fairly safe drug to use. if you're not going to do lifestyle as your first approach. You're never going to do better than lifestyle. So we've got drugs like this glitazone family of drugs. In my opinion, they should be taken off the market. We should begin a program at both the local and national level that promotes lifestyle and focuses hard on diet and exercise. If we'll do that, the chances that we'll curb this epidemic of obesity and diabetes are excellent.